Hello, all you healthy blood pressure warriors. My name is Ingrid, and I want to welcome you to the healthybloodpressure.com channel. High blood pressure is an indicator of how forcefully the heart pumps blood against your artery walls. It also depends on how wide your blood vessels are. A higher blood pressure number indicates that you may be at a higher risk of heart failure or stroke. Some of the reasons for developing high blood pressure are out of your control, while other causes are completely under your control. Better understanding of the causes and effects of your high blood pressure will help you to manage your blood pressure better. In this video, I'm going to talk about the 12 leading causes of high blood pressure. Here are the most common ones. Number 1, smoking. Smoking or chewing tobacco can suddenly raise your blood pressure. In some people, this effect may be temporary, but in others, tobacco can be a cause of major concern for your arteries. This is due to certain chemicals in the tobacco that damage the lining of the artery walls. This narrows the arteries and restricts blood flowing through them. So, your heart has to work extra hard to pump blood into these arteries. This repeated action may result in you becoming a hypertension patient. Number 2, being overweight or obese. As you gain body weight, the need for oxygen and other nutrients also increases. Your blood vessels have to work significantly harder to supply those nutrients to your tissues. The increased weight and body surface causes your heart to pump harder than its capacity. This increases your blood pressure. Consequently, obesity is a leading cause of high blood pressure. So maintaining a balanced body weight is one of the best ways to prevent high blood pressure. For mild high blood pressure, losing weight can often fix the problem without medication. Number 3, lack of physical activity. Inactive people often end up having poor blood circulation. This means that all your cells may not receive proper amounts of blood and nutrients. To fix this, your heart tends to pump harder to make sure the blood reaches every cell of your body. This is how your heart ensures that your body gets its proper nutrition. But by doing so, the heart works harder than normal, and this raises your blood pressure. This is why exercising is so important. When you exercise your heart muscle, it will grow stronger and work more efficiently and lower your blood pressure. Number 4, too much salt in the diet. The American Heart Association recommends no more than 1,500 milligrams of salt in a day. Sadly, most people eat way more salt than that. Sodium mainly comes into your body through table salt and processed foods. It's this sodium that causes all the problems. It increases water retention in your body. This extra water puts stress on your heart and your blood vessels, and that's when your blood pressure rises. Number 5, too much alcohol consumption. Scientists are still researching for better understanding how alcohol raises blood pressure. But studies have found that high amounts of alcohol can reduce the levels of nitric oxide in the body. Nitric oxide is a compound that helps in dilating or expanding your blood vessels. When alcohol reduces the nitric oxide, your blood vessels become narrower. Narrower blood vessels means your heart has to pump harder to get your blood circulating your entire body, and this raises your blood pressure. The research finds that it is best if women drink no more than 1 alcoholic drink a day, while men should limit their drinks to 2 a day. Number 6, stress. When you're stressed out or anxious, your body produces many emergency hormones. These hormones cause your heart to beat and pump your blood faster. This raises your blood pressure. When your stress goes away, the extra hormones are flushed out and everything goes back to normal. But in today's life, most people deal with chronic stress. This means that the stress never goes away. Basically, your body remains on high alert and the blood pressure doesn't get a chance to go back to normal. Learning to lower your stress levels will allow your heart to slow its pace and your blood pressure to lower. Number 7, older age. A lot of things change in your body as you grow older. One change you can't see are the blood vessels. Younger people have blood vessels whose walls have a certain level of elasticity. This elasticity helps in the smooth passage of blood flow. With age, however, the walls lose some of their elasticity. Arteries and veins become less pliable and are narrower. As a result, your heart has to pump more to get your circulation in place. All this extra effort on your heart and increased pressure on your blood vessels creates high blood pressure. Number 8, genetics. You were born with your genes, and you can't change them. Sometimes your genes will help you stay healthier, and sometimes your genes make you more susceptible to health concerns and diseases. Since you can't change your genes, it is extremely important that you know your family's medical history. This will help you take preventative steps to ensure your best health possible. If any of your family members have been diagnosed with high blood pressure, you automatically fall under the at-risk category. Letting your doctor know if high blood pressure runs in your family is the first step. Your doctor will suggest preventative measures that can keep high blood pressure at bay. In addition, you can certainly reduce the risk of high blood pressure by maintaining an overall healthy lifestyle. Number 9, medication side effects. Are you currently on medications for other health issues? Some of them may cause your blood pressure to shoot up as a side effect. Medicines such as certain decongestants, steroids, and antidepressants may raise your blood pressure. Others include birth control pills, anti-inflammatory drugs, immunosuppressants, and testosterone treatment. It's not just prescription drugs. A lot of natural supplements can also cause blood pressure to rise. Some examples include St. John's wort, arnica, ginseng, and licorice. Make sure that your doctor is aware of all the medications and supplements you are taking in order to better understand the reason your blood pressure may be rising. Number 10, chronic kidney disease. The main function of your kidneys is to get rid of waste products through urine. However, those with chronic kidney diseases may have kidneys that can't eliminate the waste as quickly as the body requires. When your kidneys don't work properly, there can be an increased amount of water retention in the body. Water retention can cause your blood vessels to constrict, and this means your heart has to pump with more pressure. This is how kidney diseases can cause your blood pressure to rise. Number 11, adrenal and thyroid disorders. Aldosterone is a hormone secreted by your adrenal glands to balance the sodium and potassium in your body. Too much aldosterone can disturb this balance and retain more sodium than potassium. This causes water retention in the body that affects the heart and the blood vessels. Your heart works under stress and causes your blood pressure to rise. Too much thyroid hormone can also raise your blood pressure. This condition is called hyperthyroidism. With this disease, your heart rate can get too high and cause your blood to pump harder, which raises your blood pressure. Number 12, sleep apnea. Sleep apnea is a condition in which breathing keeps stopping and starting when a person is asleep. Because you stop and start breathing, oxygen levels keep fluctuating throughout the night. At low oxygen levels, your heart gets a signal to pump harder so that your cells are not deprived of their nourishment carried in the blood. This strain on your heart causes a rise in blood pressure levels. In summary, there are many factors that can lead to high blood pressure. Sometimes there are more than one cause, some of which are interlinked. The good news is that many causes can be treated with conscious lifestyle changes. In addition, knowing the reasons for your high blood pressure can enable you to take preventative measures to limit the stress and strain on your heart and blood vessels. Remember that you and your doctor are a team, and together you can create a heart-healthy plan to help you live a long and active life.
Hi there, if you suffer from high blood pressure like I do, and you want to receive my educational videos about how to lower your blood pressure, I'd like to ask you to do 3 simple things right now. Number 1, click the subscribe button right there. And then number 2, click on the bell icon right down there so that I can notify you the moment I release a new video. And number 3, watch another one of my more popular healthy blood pressure videos right over there. Okay, thanks for watching and have a happy and healthy day.